Across the country, in the last month, the number of children hospitalized with COVID-19 rose 52% compared to the month before. It is an alarming number, and some states are seeing real problems. Florida, Illinois, New Jersey, New York, and Ohio have the biggest rise in pediatric cases, according to NBC News. But here's the thing. Since many hospitals routinely check new patients for COVID, the headline sounds worse than it is. Many of those kids were hospitalized for another reason and found to have COVID without showing symptoms. Dr. Anthony Fauci, the nation's top doctor on the pandemic, mentioned the fact during a phone briefing today. He said many children are hospitalized with COVID as opposed to because of COVID, reflecting the high degree of penetrance of the infection among the pediatric population. So, still not great. There is a lot of infection in every community, but it's not something that should terrify parents. And the facts are even better here in Oregon.
Unlike the rest of the nation, Oregon is doing quite well. We are not seeing an increase in the number of hospitalizations attributed to pediatric COVID-19.
Dr. Dawn Nolt is an infectious disease professor at Oregon Health and Sciences University. She said, yes, the virus is spreading, but no, you may not even realize your child is infected.
But we know that children who have COVID-19 infection tend to have less symptoms or no symptoms at all.
Both variants of the virus continue to spread in the Northwest and around the country. The U.S. Tuesday hit a record high 7-day average with 265,000 infections. And that does not count the many other infections found through home tests but not reported to the government databases. Bottom line, COVID's variants are not putting more Oregon kids in the hospital than before. Still, it is okay to be worried and to follow the doctor's orders.
What we want to tell parents is that if you or your child's able to be vaccinated and boosted, that will give you a lot of protection against Omicron. And to remember that there has been no variant that has been resistant to good mask wearing.
There are a lot of questions right now about the virus, like can you tell if you have COVID or the flu or just a cold? Well, we have you covered tonight with a simple breakdown. Take a look. Here's what you need to know. Right now, the main symptoms of the Omicron coronavirus are a runny nose, headache, fatigue, sneezing, sore throat. For the common cold, you'll probably normally endure a sore throat, headache, sneezing, and runny nose, but not so much on the fatigue side. And the flu is going to bring on a high fever, sore throat, muscle or body aches. Something that you will not experience, though, is trouble breathing. And we're sorry if you have any of those symptoms. That's not pleasant. At this point, with the quick spread of COVID, it might be better to be safe rather than sorry. If you're not feeling good, check in with your healthcare provider to find out whether you need to get tested.